What's the true scale of China's COVID-19 outbreak? A leaked document from the country's top health body gives insight. The same agency halting updates of daily infection numbers, the country no longer counting its total patient numbers. No more quarantine requirements for China's incoming travelers. That's despite an explosion of new cases overwhelming hospitals and funeral homes.
The hospital is just overwhelmed from top to bottom.
And Beijing sending over 70 warplanes near Taiwan in just 24 hours. Tensions brewing after President Biden approved the latest U.S. support for the island. Welcome to China in Focus. I'm Ellie Hart, in for Tiffany Meyer. How big is China's recent COVID-19 explosion? Really? Leaked meeting minutes from the country's top health body puts the daily infection rate in the tens of millions. We look at the details.
It's hard to know China's actual numbers when it comes to COVID, as the Chinese Communist Party, or CCP, has hardly been forthcoming since the pandemic started. But according to leaked minutes from an internal meeting of China's National Health Commission last week, officials say about 250 million people were infected with the disease in the first 20 days of December. That's about 18% of China's population. The figure is exponentially higher than the regime's official virus tally. Bloomberg and other media outlets confirmed the notes with anonymous officials involved in the discussions. A screenshot of the conference notes circulating online shows the virus apparently spinning out of control, especially in Beijing and southwestern China's Sichuan province. It appears to have hit over half of the residents in those areas. After nearly 3 years of strict zero COVID policy, the Chinese people have been left with little natural immunity against the CCP virus. The minutes cited 12 major Omicron subvariants found in China. The 3 listed most prevalent are BA5.2, BF7, and BM7. How the agency arrived at these figures remains unclear, as the country abandoned mandatory mass virus testing earlier this month. But the numbers do appear consistent with anecdotal evidence of a spike in infections and deaths nationwide, including among the CCP's elite circle. The numbers also align with analysis by UK researchers projecting up to 279 million cases nationwide, with up to 2.1 million deaths. The virus surge has overloaded morgues and hospitals across China. Experts predict the peak in the whole country will come in January, when tens of millions of people travel across China to celebrate the Lunar New Year with family. Jeremy Sandberg, NTD News.
China's top health body is no longer publishing daily COVID-19 infection numbers. The move comes as the country sees a massive surge in virus cases, and amid skepticism that the official toll doesn't reflect the true scale of the outbreak. The country's top health body, called the National Health Commission, said another agency would take over the task, China's CDC. The CDC is a lower authority compared to the NHC. It's unclear how often the CDC would publish the COVID-19 reports. The agency traditionally only publishes monthly updates. China also no longer tallies its total number of infections. Authorities have shut down PCR testing booths nationwide, adding they will stop gathering data on asymptomatic cases. Meanwhile, the CCP virus continues soaring. The CDC of China's eastern Zhejiang province published estimates over the weekend, saying that right now, 1 million people in the province are getting infected daily. That's with the CCP virus, which causes COVID-19. The agency adds that the province's peak of infection rates is due in about a week, around New Year's Day, and that those numbers will last for 1 week. The CDC also noted that during the peak, the province's daily infection rate would rise to 2 million. These estimates are based on virus tracking and testing of communities in the province. Over in Shandong province, local CDC officials said Friday that they're seeing around 500,000 daily infections there, and that over the weekend, that figure would rise by about 10%. Also on Friday, CDC authorities in the southern province of Guangzhou warned the peak of the outbreak is around the corner, and that with more than 250,000 new infections appearing locally every day, that number is growing. These 3 provinces are among the most populous in China. Together, they're home to around 300 million Chinese citizens. Experts predict the COVID-19 peak for the country as a whole will arrive in January. That time also marks peak travel season in China. Every year, tens of millions take vacations or go to visit loved ones in celebration of the Lunar New Year holiday. China is ending its quarantine requirement for travelers coming into the country. Starting January 8th next year, passengers arriving in China no longer have to go through mandatory quarantine. This as the country sees a massive surge of virus infections, with multiple regions reporting at least hundreds of thousands of new infections daily. Chinese leader Xi Jinping is calling on authorities to do what's, quote, feasible to help patients. Next, let's take a closer look at how China's hospitals are coping. Reports say many are overwhelmed. Patients even risk being turned away in some areas due to a lack of beds and resources. Here's more.
Hospitals in China are under siege from a new wave of COVID cases. One in Shanghai said it expected half of the city's 25 million people to get infected by the end of the week after Christmas. In Beijing, healthcare workers said patients might have to be turned away due to a lack of beds and resources. Howard Bernstein is a doctor at the city's United Family Hospital.
The hospital is just overwhelmed from top to bottom. So, the ER filled up with people. A lot of them got admitted to the hospital. They're not getting better in a day or two, so there's no flow. And therefore, people keep coming to the ER, but they can't go upstairs into hospital rooms, so they're stuck in the ER.
The new upsurge comes after President Xi Jinping's communist regime suddenly abandoned strict measures aimed at stamping out the virus. State media say frontline workers have been told to work while sick, and while retired staff have been brought back in some areas.
Workers in two of China's biggest cities are going back to the grind. That's as the country battles the ongoing COVID-19 surge, and with millions already infected and hospitals and funeral homes overwhelmed. Let's zoom in.
There were signs that mainland China's biggest cities were edging closer to living with COVID-19 on Monday, with packed morning subway trains in Beijing and Shanghai. People mostly stayed home in the weeks after China scrapped its ruthless zero COVID restrictions as they tried to avoid the disease or dealt with an infection. China is the last major country to move towards treating COVID as endemic. Now the virus is infecting millions there, left largely unchecked across the country, while residents have returned to commuting to work. I am prepared to live with the pandemic. After all, lockdowns are not a long-term solution. Shanghai's streets in particular, even with just a handful of cars on the road, were a sharp contrast to April and May. That's when the city endured a strict and bitter lockdown, and hardly anyone went outside. China had reported no new COVID deaths for the 6 days through Sunday. However, health experts and residents worry that China's statistics do not reflect the actual number of fatalities. Analysts say the economy, the second biggest in the world, is expected to suffer further in the short term, after zero COVID slowed China's growth to its lowest rate in nearly half a century.
Is Omicron to blame for the virus surge that's wreaking havoc in China? Or is there another subvariant spreading alongside it? Some patients are showing symptoms that don't usually appear when sick with Omicron, but that did show up widely in Wuhan when the pandemic first broke out. Here are the details.
Reports from Chinese hospitals are raising an unexpected concern. The lungs of some COVID-19 patients are appearing white on CT scans, indicating lung infection. But Omicron is widely known not to attack the lungs, which makes it less dangerous than other variants. In the past few days, people have flocked to Chinese social media Weibo with similar reports that some of those infected with COVID-19 were also diagnosed with severe pneumonia. CT scans show parts of their lungs turned white. The appearance means the lungs are infected, posing danger to affected patients. The so-called white lung syndrome was a typical symptom found in Wuhan City at the beginning of the pandemic. Those who've shared the news online include medical staff, family members of the deceased, and patients themselves. Among those showing the symptom was the father-in-law of a well-known Chinese scholar. He died last week of COVID-19 related pneumonia. His CT scan showed 1/4 of his lungs had already turned white, and there's more. A doctor in Beijing recorded the process of how a 70-year-old patient's lungs turned white via CT scans. The patient died one day after the infection reached his lungs. Back online, a medical worker from eastern China's Jiangsu province shared a set of related photos on social media site Weibo. The pictures came from the CT scans of 2 white lung patients. One of them showed a high degree of fibrosis of the lungs. It was so advanced that the shape of the lungs became obscured. The medical worker wrote he's seen more white lung patients lately than since he studied medicine in college.
Over 130 sublineages of Omicron detected in China within 3 months. That figure comes from a Chinese state media report published last week, citing Xu Wenbo, the head of the National Institute for Viral Disease Control and Prevention. Xu explained that variants known as BQ1 and XBB are new sublineages of Omicron. They're more transmissible and more capable of infecting vaccinated people, though they don't pose significantly higher mortality rates. Hustle and bustle at a Christmas market in Shanghai on Christmas Eve, despite much of the country struggling to cope with the ongoing virus surge. 2 young people who recently recovered from COVID-19 shared why they came to the market.
My friends were basically all testing positive, and I've recovered, so we wanted to take advantage of Christmas. And it's the weekend. We wanted to walk around and enjoy the air.
Christmas isn't considered a holiday in China, but for young people in big cities, it's become trendy to spend the time with friends. But this year, walking shoulder to shoulder through the market comes with some concern.
Of course we're worried, because there are people who might be positive for COVID-19 or already recovered. I'm worried for those who haven't tested positive yet. For us, the first batch of people who tested positive for COVID-19, we endured it with a lot of effort.
In a post on Chinese social media, a hospital in Shanghai shared an update last week, writing that COVID-19 cases were surging in the city, and that until the end of the year, 12.5 million people will get infected locally. That's half the city's population. Sending over 70 warplanes toward Taiwan in just 24 hours, Beijing is upping its pressure on the island after Washington carved out new support for Taiwan in the defense spending bill. NTD's Iris Tao has the latest updates.
Kicking off military drills, sending a record number of fighter jets, firing off a diplomatic statement, and China is blasting the U.S. over its latest show of support for Taiwan. This comes after President Biden last week signed an over $800 billion defense bill. The bill would authorize up to $10 billion in military aid to Taiwan, with the aim of helping it deter aggression by Beijing. While Taiwan praises the passage of the bill, the Chinese Communist Party is firing back with threats. According to Taiwan's defense ministry, within just the last day, China sent 71 warplanes toward the island, amounting to the largest reported incursion to date. China then called the drill a response to collusion and provocations by Taiwan and the U.S. The White House, meanwhile, is condemning China. According to the Associated Press, a spokesperson for the National Security Council says China's latest activity is destabilizing, risks miscalculations, and undermines regional peace and stability. The official, who commented anonymously, added that the U.S. will continue to assist Taiwan in maintaining a sufficient self-defense capability in line with the U.S.'s long-standing commitments. Reporting from the White House, Iris Tao, NTD News.
That's all for today's China in Focus on YouTube. We're now sharing a shortened version of our program here after being demonetized for more than a year. Here's what's coming up in our second half. Former Chinese Communist Party Chief Jiang Zemin is dead, but the persecution campaign against a spiritual group that he initiated in 1999 lives on. What other groups fall victim? And what lingering effects has it had on Chinese society?
You don't have freedom. You don't have freedom of, if you see that the government can turn on 100 million people that all believe in, truthfulness, compassion, tolerance, what are they going to do to you? What chance do you have?
We spoke with Ben Maloney, Digital Outreach Director of Falun Dafa Information Center, to find out. The full episode is available on our partner platform, Epoch TV. To sign up, click the link down below. Thanks for watching China in Focus. I'm Ellie Hart. Enjoy the rest of your holiday.